Hi, I'm Erica Brooks. I'm one of the case management nurses here at Crawford Memorial Hospital, and I work closely with our swing bed program and our patients involved in the program. So the swing bed program here at Crawford Memorial Hospital is a program that really helps you transition from the hospital to home. It helps bridge that gap. Sometimes when you're in the hospital for extenuating circumstances, planned surgery, unplanned surgery, you've been sick and you need IV antibiotics, sometimes you need extra care 24/7 in order to be able to hopefully return home. We can help bridge that gap with continued therapy, continued IV antibiotics, or really any other skilled need that you have in hopes that you are strong enough and healthy enough to return back to your prior living situation of home or assisted living. There's a lot of different ways that you can qualify for swing bed. A lot of our patients require therapy, whether that's physical therapy, occupational therapy, and/or speech therapy. Those types of therapy needs may arise after you've been in the hospital for a long time, you've had a planned surgery, you've had an unplanned surgery. Sometimes even just being in the hospital debilitates you because you've been in there so long, and so your body needs therapy in order to regain its strength to hopefully return to that prior level of function that you had. Also, a lot of our patients need IV antibiotics that they cannot get in their homes. Sometimes those IV antibiotics are multiple times a day for multiple hours, and it's really no way for you to come in as an outpatient or to do that on your own. Being in the swing bed program provides you in that safe environment with trained staff to make sure that you are getting the care that you need. So one of the advantages of our swing bed program is our length of stay is around 12 to 15 days, depending on what is going on. Now, sometimes some of our patients need IV antibiotics for longer, but we really have such an individualized treatment plan that we find that it's very intense therapy. We get you stronger very quickly in order to help get you home. And since it's such an individualized program, we also work closely with what you may need outside of our program. So sometimes we have to do home safety evaluations to where our therapists that have been working with you here in the hospital in our swing bed program actually go to where you were living previously to make sure that the goals that we've been working on here will also help you reach your goal of being at home. And sometimes even after you've been in our swing bed program, you still may need additional care and services, and we help coordinate that. We see if you then need home health at discharge or outpatient therapy. We make sure that you have all of your follow-up appointments. We also talk about local resources and any other help that you may need in your home to help get you to be as independent as possible to that prior level of function. So even though your care as an inpatient may have required you to be in a much larger facility, the recuperation and the continued therapy and IV antibiotic type of care that you need can be done here in your community, in the setting in which your family and friends can come visit. If you have any more questions regarding our swing bed program, whether you qualify or a loved one qualifies, we'd love to talk to you about that. Please give us a call at 618-546-2470, and one of the case management nurses or discharge planners will be happy to talk to you about any types of questions you have about our program.